Secretary Becerra, I want to also address the 988 implementation. I was proud to be the co-sponsor of the 988 legislation along with former Senator Cory Gardner, and believe that it has been a remarkable service. You know, we always had a suicide prevention hotline, but nobody remembered the 10-digit number, especially at a time of crisis. And when we launched the 988 number, it has literally been a lifeline for so many. I want to ask you specifically about a pilot program that has been underway regarding LGBTQ youth. You mentioned already when you call, there's a screening for service members. If you're a veteran of our military service, you can get routed to appropriate and knowledgeable services. Last year was a record-breaking year for legislative efforts around the country that target LGBTQ individuals, including the ability to receive health care, inclusion in education, even access to public restrooms. It should not, therefore, be a shock that lesbian, gay, bisexual, and transgender youth are more likely to experience anxiety, depression, and thoughts of suicide than their peers. In fact, LGBTQ young people are more than 4 times more likely to attempt suicide than their peers. We're seeing that these attacks do not live in a vacuum and that they have real-world consequences. I have been glad to work with you and the department in creating and now expanding specialized services within the larger 988 Crisis and Suicide Prevention Lifeline to provide response to LGBTQ youth in crisis. We know that there's a need there. In February alone, almost 40,000 contacts were answered by the LGBTQ sub-network of 988. Can you expand on how these specialized crisis services for LGBTQ youth and the pilot has helped support this population?
Madam Chair, absolutely, because I think you're going to the heart of what makes 988 so valuable, and that is that you have individuals who are challenged, who are at a moment of crisis, who turn to someone and actually trust, will extend confidence in someone through a phone call, through a chat, and that's a tremendous thing. And so to begin this pilot back in September of 2022, see it working, expand it to some 7 different call centers, and see more than 40,000 calls come in specifically from the LGBTQ community means that they're responding. We want to continue that because we want anyone who's facing crisis to feel like they can have the confidence to make the call, have their call be personal and private, and also get the help they need.
No, thank you. I was just singing the praises of the program, but still, there are many people who are unaware of this crisis service. And I understand HHS is planning a public awareness campaign to spread the word on 988. Will the proposed increase for 988 included in the budget request support the anticipated increase in call volume as a result of the awareness campaign that you're conducting?
We're hoping to address it. We're hoping states will further step up to the plate to help us because at the end of the day, it's their call centers that are the front line. So we need states to continue to grow their capacity because we can only depend on the generosity of Congress to help sustain that national component. What we don't want is to have gaps. We want you to be able to call from whatever part of the country you're in. So we continue to partner with states and tell them, please, make commitments in your own budget to sustain your operations. Some states have actually done that. They've got a permanent flow of dollars. Most states don't.
Thank you.